the fourth tip I had here, I have one of the very important things. Okay, so when you're in nursing school, I know they talk about, you're going to have, 4 patients or 5 patients. And a lot of the times they're mentioning more so like if you're on a med surg unit or a tele unit or anything like that. Most of the time they're talking about just a generalized unit. Obviously, if you're in the ICU, you have like 2 patients. But generally speaking, if you're on any other unit, you have about 4 or 5 patients. And so it's all about prioritizing time. So you have to be in every single one's room to do all sorts of tasks from, their vitals to medications to assessments to just all sorts of stuff, right? One of the big things that's super, super helpful, one of the hacks I tell people all the time that helps and actually helps relieve some of the stress is making sure you're always clustering your care. So making sure that if you're going to be in a patient's room and you need to do their vitals, you need to do their sugar, their sugars, right? Check in their sugars. You're needing to give them medications. You need to empty their Foley. You need to do an assessment. Like all these things, make sure that when you go in there that you have all the supplies you need. So you have like all of their medications ready to go. If you have to give them a bath, you have all the supplies for that. Anything that you would need for this patient, just make sure, please, that like this one time when you go in, you have everything together so that you can get them done and they should be good to go for a while. So then you can be with another patient for a period of time. There is nothing worse for a patient, and especially night shift nurses, you guys are going to know this, is going in and like doing vitals, and then the next second is like someone coming in and, oh, it's your med time, and they were like napping or like sleeping, and then the next second you come back in and you're like, oh, we need to do a bath, we haven't had a bath for you today, or it's just stuff like that. And patients, aside from yourself, it's just so much easier. It makes your night go so much easier when you can just cluster everything all together, get done. They can be situated for a good amount of time. Versus, oh, I forgot to do this. Oh, I forgot to do this. And then now you're running back in there multiple times. And then you're in another patient's room. They're needing something. It becomes a chaotic mess pretty much, right? So really kind of prioritize your patients, like you probably already know, like which ones are the first ones you want to see first, second, third, fourth, and then everything that needs to be done for that patient for the evening, and kind of like organize your time. I always did that before shifts. I always went through everything to see what needed to be done for every single patient. If any of them had any imaging they were going to be doing in the middle of the night, if any of them had all these medications throughout the night, if any of them had like blood that needed to be drawn at any time that had a central line. Just I organized my night to the point to where when I was in there, I was trying to do as much as I could at one time. And a lot of that is if I had to be in there to do meds and do a whole assessment and all of this stuff, I normally always told my PCT or CNA to like, don't worry about, patient in 34. I'm going to do the vitals. I'm going to do their sugar because I need to be in there anyway to do this assessment first and then do their medications, because depending on this is what's going to depend on what I'm going to be giving them for a medication. So it even actually kind of helped the PCT and CNA that they could actually just cross them off the list and be like, okay, cool, I don't have to worry about that. Kristen's got it. But cluster care is very, very, very important. So if that's not something that you do now, you're going to learn the hard way when you find yourself going in there and out. So it's going to be an annoyance to you, but it's also going to be an annoyance to the patient that you're in there every 2 seconds, because no patient wants you in there every 2 seconds. They will get annoyed and be like, just get done what you need to and leave me alone for a while, especially a night shift. There are going to be people that are like up, and then there are going to be people that are actually asleep. So that is my next big thing, is just making sure that you're really trying to cluster your care for patients. It's very important. And it's just makes your night a lot easier when you can get that stuff done all together, right? So something I learned the hard way when I was a new grad, and it was a little chaotic. So I wanted to make sure I wasn't putting anyone else through that. So that's another hack of mine that I wanted to let you guys know of. I do have a lot more other hacks, but what I'm going to be doing is I'm going to be making a whole resource paper. So I'm going to be putting these all on a sheet. So there's a lot more added than just this. So if you want a whole complete list of a lot of other hacks that I have, aside from just these ones that I told you guys about today, make sure you guys subscribe onto the Aspen and Ash page, which is where I do a lot of like the Nurse Kristen stuff on, that has my blog posts on. So guys, go there, read some blog posts. I have obviously the merchandise clothing. I have a lot of these free downloads. I have a challenge going on this month. I have a lot of stuff between the Nurse Kristen Kristen that comes into the Aspen and Ash shop. So I'm integrating a lot of stuff onto this page. And so this is one thing I'm doing as well with YouTube and the podcast is I'm integrating it all onto here. So basically, if you want a whole sheet resource with every hack that I have ever learned so far, and then some, you can always go to the homepage and then just scroll to the bottom where it says subscribe. And once you subscribe, I will be sending an email that will have that free resource that's going to have every single hack out there. This was like just a little small bit, by the way. This was just a little, toe in the water or whatever you want to call it. It's just a little snippet of hacks that I have for you guys. So if you want a full list of everything that I've got, make sure you guys go to aspenandash.com. Make sure you scroll on the homepage to the bottom where you subscribe for the email so you guys can get that free resource and be able to get the entire full list of everything, of every hack that I know that I can give you guys to help. I will be back next week with another amazing topic, and I can't wait for this next topic that's coming up next week. So you guys stay tuned. Have a great rest of your day. Hey everyone, if you enjoyed watching that clip and you want to see the full video to it, make sure you guys click the box here. If you enjoy watching these kind of videos and you want to see more videos from the Nurse Kristen YouTube for pre-nursing, nursing student, new grad nurses, make sure you guys hit the subscribe button over here.